And we are back on InMore Clinical Conversations, where knowledge meets practice and confidence is built through clarity. Hi, everyone. I am Dr. Phoebus Carranza, and I'll be your host. In the previous episode, we explored regenerative treatments such as polynucleotides and skin boosters, and how they support long-term skin health. Today, we are shifting the conversation slightly from what these treatments do to how we decide what the patient truly needs and how proper training plays a crucial role in that process. We will also be talking about Koru Academy and the experience behind the Aesthetic Training Program 2026. One of the biggest challenges in aesthetic today is patients often come in knowing what they want, but not always what they need. And that's where training, expertise, and clinical judgment really matter. Joining us are two trained aesthetic doctors and are also part of InMore Medical and Koru Academy training program. Please welcome Doc Sophie and Doc Eloisa. Welcome, doctors.
Thank you so much for having us.
It's my pleasure.
Thank you, and it's truly an honor to be here.
It's my pleasure. By the way, Doc Sophie, I love the Koru Aesthetic Dialogue. I've watched it and I was amazed with the topics that was in it. I really appreciated and loved it.
It was so much fun.
Before we dive in, can you share experience being part of InMore Medical and Koru Academy's aesthetic training program this year, 2026?
I think this year's academy program was something outstanding. It was very different because usually I think that trainings are more designed to know about the product and how to inject it. But here we did a more comprehensive approach on really diagnosing our patient's face, mapping it, and really understanding the key ingredients and how to use it in the best way possible.
I absolutely agree with it, Doc Sophie. Proper assessment is key. How about you, Doc Eloisa?
Indeed, it's been great experience. So aside from the theoretical side, which feeds our mind, of course, we have the one that boosts your confidence by doing the hands-on, the workshops. So it makes you more confident in practicing your skills.
Yes, I totally agree with it, Doc Eloisa. Next question. What makes this training different from other aesthetic programs you've encountered? Let's start off first with Doc Sophie.
So I think first of all, the community. It's very important that when we gather together between colleagues that we just openly speak about our own experience. We share it with each other in order to learn from each other. So I felt this great connection here in the Philippines. So it was a huge honor to be here.
Agree again. The energy, the vibe of the community is so essential in progressing in this aesthetic industry. How about you, Doc Eloisa?
Okay, so for me, it's on a more personalized level. Like you deal with the holistic approach. So aside from the anatomy, you have the complications, the assessment, and how to manage these complications, the blood vessels, the blood supply. So it's really holistic approach. That's really what I want with this Koru Academy training. So because before, I'm into just how to inject fillers, how to inject these polynucleotides, but now it's on a more deeper sense. Like I will ask myself, why should I inject this? Why should I not inject this?
Yes.
And why must I inject this?
Yes.
So really, it's really a holistic approach.
Yes, agree. It doesn't end with the procedure alone. It starts first with proper assessment and, of course, if the patient is indicated for that procedure. Totally agree again. For the next question, and from your perspective, how important is proper training in shaping how doctors approach treatments today? So it's more of a follow-up questions to the previous one.
So yeah, I just follow up on what you just mentioned. I think the proper assessment is so important, and this because this is the only thing that we can't study from the books, right? It's very individual and personalized medicine. So we really have to make this diagnostics before in order to really choose what product we want to apply. So I support your opinion on that as well.
Yes.
Otherwise, it's just following a protocol or just providing a service to our patient or just using what we have now in our toolbox.
Yes.
But
Yes.
it's more on what the patient actually needs.
Yes, agree. How about you, Doc Eloisa?
Yes, totally agree also, Dr. Sophie. So I think this learnings is like, it's everything. So you need to go back to your basic, like knowledge on your anatomy, of course, the blood vessels, that's very
Uh-huh.
important. So, and we also emphasize here that not all can practice aesthetic medicine. So you should be like invest on your education and review your anatomy. Of course, that's very important.
Yes. Prioritizing the safety of the patient comes first. Let's talk about something we see every day. Patients coming in with very specific requests. So for the first question, Doc Sophie and Doc Eloisa, how do you differentiate between what a patient wants and what they actually need? Doc Sophie?
So I actually think that there is a difference between our regions where we treat our patients,
Yes.
right? So in Europe, patients rarely come with a specific request of one specific treatment or one brand. It's rather that they come with a specific problem that they want to have fixed.
Yes.
And sometimes they come with a question like, I've heard about this treatment, I've seen it on social media,
Yeah.
or my friend had it done.
Yes,
but
the
it's
trends in
never
social media.
specific.
Yes.
What about you?
How about you, Doc
Oh,
Eloisa?
yeah. Almost the same, but here in the Philippines, I think once is more of a personal thing. Like you want to look like this famous celebrity, or
Yes.
you want to look like this person that you idolize or you saw on social media. So you'll go to the clinic. You want like, Doc, can you put 2 ml fillers on my lips or make my nose this high? So I think that's the ones, I think. And then the needs is this time your degree as a medical doctor and with training will come into play that you will say that, of course, you will listen to the patient. That's very important.
Yes.
But at the end of the day, you're still the doctor. You decide what's best for the patient. You'll give him or her the best possible care
Yes.
in a natural and
Uh-huh.
ethical
Yes.
way.
Exactly. They already have an image in mind and they have a good friend, Dr. Google. But it shouldn't be that way. It should be physician guided. How about the next one is why is the distinction important in aesthetic medicine? In knowing what the patient wants and of course what they actually need. Okay, Doc Eloisa? Yeah?
I think listening is very important. So you will not invalidate that the patient wants something. So
Uh-huh.
you listen to what the patient is saying. I want this, and then after that, you in a subtle way, you're the doctor.
Uh-huh.
So this time, your medical expertise, the holistic approach,
Yes.
your anatomy, the assessment will come in. So you will say that this is what you want, but I think this is the best for you being your doctor because your doctor only wants the best for you.
Okay. I love that word, holistic. I love the word holistic. How about you, Doc Sophie?
So I completely agree. I think that the best outcomes actually come from an alignment between the opinion of the doctor and the opinion of the patient. So of
Yes.
course we have to listen to them and ask what is their wish to achieve. This is where my assessment actually starts, but it's true that in the end it's up to our professional opinion on what they actually need and what they would actually benefit from.
Yes. We always have to listen and we always want to patient meet halfway. It's about our journey together with the patient. So once you understand both the patient's wants and needs, how do you make that clinical decision? I'll start first off with Dr. Sophie.
So I would say I start with this assessment of what is the most evident problem of my patients. And actually, they come with me with that specific concern, and that might be either skin quality or a structural problem,
Yes.
right? So, and then second of all, we have to consider very personal factors like if they can afford it,
Yes.
if they can integrate
Yes.
it into their daily life in
Yes.
terms of downtime, in terms of pain. So all of this assessment comes first. Then second part is definitely the patient's education. It's hard to say patient's education when it's rather like all the information that we have to give our patient. Because finally, I think it shouldn't be just our responsibility to take this decision on what treatment they should get.
Yes.
So I give them all the information and then they can decide what they want to get done.
Yes, it's a partnership. Yes. How about you, Doc Eloisa?
Yeah, I totally agree also. So it comes first with the clinical assessment, the mapping, and then also, I think it's also a collaboration between the
Yeah.
patient and the doctor. So you don't dictate.
Yes.
So it's
Agree.
a give and take. You listen to what they want to achieve, and you as a doctor, you want also to lay all the cards that you want these procedures to be done to them. So reassessment, of course, the safety, and all of those factors.
Yes. It's the conversations that we have with our patient. Next question is, how do you explain your recommendations when they differ from what the patient initially asked for?
Okay, so it's almost the same like the wants and the needs.
Yes.
So for me, I will tell my patient that safety comes 1st. Then I will explain reality versus expectations, or expectations versus reality. And then, of course, at the end of the day, it's still me being the doctor. So
Yes.
I will tell them that I just want the best for them.
Yes. Physician guided, totally agree. How about you, Doc Sophie?
I agree. I explain them everything, like everything, until the last detail, until they're convinced.
Yes.
Until it's nothing between what they actually came for originally to what I would recommend them.
Let's make this more real. During your time in Koru Academy, was there a moment that changed how you approach patients? Next question is, can you share a case where understanding a patient's need, not just the request, led to a better outcome?
Okay, I think it's not
Eloisa.
necessarily on the Koru Academy, but more on my personal or
Yes.
private practice. So there's this patient that comes to the clinic and she wants to have tear trough fillers because of dark circles. Because we should be very careful, right? Doctors, we can have the Tyndall effect
Yes.
or the edema. So in those cases, I told my patient that you don't need the filler because it's more of the anatomy, the infraorbital fat pad that is going down, and also the skin is thin on that area. So the dark circles
Yeah.
is more pronounced. So maybe not fillers, but we have these biostimulators or other procedures aside from fillers.
Yeah. And maybe some polynucleotides.
Right.
How about you, Doc Sophie?
Our favorite polynucleotides.
Yes, polynucleotides.
So something what you always can learn from Koru Academy is to have the gathered information and knowledge of key opinion leaders and experts all over the world. So this is where we actually learn, and this is where we can get inspired, right?
Yes.
Because we all have our daily clinical practice. We have our preferences in terms of products and of indications and in terms of injection techniques. But this is where we can learn
Yes,
and
yeah.
get inspired. So I
Yeah,
think this is
sharing-
beautiful. Every day you learn something new.
Yeah. Sharing clinical cases is super important. We are continuously learning a lot of things from our fellow doctors. Last one, what lessons from training stayed with you in real practice? Who wants to go first? Doc Sophie or Doc Eloisa? Okay, Doc
I'll
Eloisa.
take it. Actually, Koru Academy emphasizes the holistic approach. Again, it's a whole thing. So not just a portion of, I want those areas to be done. So it's a holistic approach, the anatomy, the proper assessment. So you will look at the face as one,
Yes.
as a whole.
How about you, Doc Sophie?
I think Koru Academy gives you a great opportunity to also learn about products and about techniques that you might not have integrated into your daily practice yet.
Yes, yes.
So as you can see it from another professional, you might get inspired to do so.
Yes, techniques. I love that. What makes InMore products amazing? Let's start first with Dr. Sophie.
I think InMore products always have the special extra that other products don't give you.
The extra
right?
umph.
The extra. Exactly. Because when you have a product, let's say like polynucleotides, you have polynucleotides in the highest available concentration on the market right now.
Yes, the highest.
If you have a hydro booster, you have a little extra that is not only the dual molecular weight hyaluronic acid, but also it comes with polynucleotides.
Yes.
So it's always the combination of active ingredients and always giving a push more than comparable products.
Huh. And it even has lidocaine in it. So comfort of the patient is also important. How about you, Doc Eloisa?
Okay, InMore products are, I think, the quality. We have a good quality products. The ingredients are top of the line, and then also it can deliver visible results. It is safe, and because of this Koru Academy, so we have like guidance from doctors of using these InMore products.
Yes. I'm also a fan, really. I love the Crystal Healer series and the Reversal series. I love Koru Pharma products. With more clinics and treatments available, standards and ethics become even more important. For the first question, how does proper training, like in Koru Academy, influence ethical decision making?
I think it's a high level training. The Koru Academy training is on a high level category because I think doctors are just not merely injectors.
Yes.
So we are equipped with a deeper practice of aesthetic medicine. So you have a knowledge, again, basic anatomy, complications, and all those assessment.
Yeah. Thank you, Doc Eloisa. How about you, Doc Sophie?
I completely agree with my colleagues here. And I believe also another important quality factor is actually the safety of the products that we mentioned before. InMore Medical and Koru Pharma has high quality products that ensure safety, purity, and efficacy for our
Yes.
patients. So sometimes you learn about a new product and you wasn't even aware that some safety standards should be considered and that are
Yes.
important. So
Yes, yeah.
then you look at other brands and suddenly you see that it's really important to choose the product in the right way.
For the next question, what responsibilities do aesthetic doctors have beyond aside from delivering results?
Oh,
Sophie?
so I believe it's a great responsibility as aesthetic doctors to see a little bit beyond just the aesthetic purpose on why a patient comes and seeks for an aesthetic improvement,
Yes.
right? Because it's all related to changes in the patient's lives. Let's say menopause, let's say a struggle in their personal life, and after that they want to regain their glow and their rebuilding of their inner well-being. It's all about self-love and self-care. So we have to see those factors about our patients and also address them.
Yes. How about you, Doc Eloisa?
Yes, I believe it goes beyond the results. So we always explain to our patient that the procedures are indicated and not just merely for money. So that's very important.
Okay. Then the follow-up question is, how do you handle situations where patients insist on something inappropriate for them?
I explain them until they're able to write a dissertation about that topic. And when they understand, they will go for my recommendations.
Okay. How about you, Doc Eloisa?
I totally agree.
Or if the patient keeps on insisting, we can always refer them to another doctor. Maybe, just maybe, I'm not fit. I'm not the right doctor for you, right?
Absolutely.
Looking ahead, do you think patients are becoming more aware of what they actually need? Okay, Doc Sophie?
There's definitely a shift in the mindset of our patients. Sometimes I'm wondering if it's a good one. Because they get a lot of misknowledge from social media as well. So patients' education became just much more important nowadays. They come with more questions, but not with more mindfulness.
Yeah. But we are happy to answer those questions.
Absolutely. It's
How ab-
our purpose.
Yes. How about you, Doc Eloisa?
Yes, I believe because of the social media, the podcasts, the influencers, so they have this innate knowledge. But our role, I think, is to tell them what's real and what's not. But I think it's up to us to have professional guidance.
I agree. And I'm glad that we are doing this conversation because we are educating our patients that we shouldn't just trust anyone or anything online. We should trust licensed doctors. Next question. Do you think the industry is moving towards more personalized, need-based treatments?
I think the industry is not, but the doctors are, and the
Yes.
industry will follow.
It has to be really physician guided. It's our duty to educate them and nurture that we are here to guide them. How about you, Doc Eloisa?
Yeah, it's the same. So the doctors are ready, but the industry is not yet. So because of this maybe emerging podcasts, what you see in the social media and your idols. So I think I think slowly we're getting there. But the doctors are already into assessing the holistic approach to the patients.
The next question is, what role will education and training play in shaping that future?
Oh, it will matter much more in the future, I believe, because we see a shift that there are more controls towards, is this a medical guided treatment? Is it a clinic?
Yes.
So all of this ensures the safety for our patients, and trainings and certifications and licenses will become just much more important.
How about you, Doc Eloisa?
Yes, I think education is everything because now we're in this like undetectable era. So everything is natural. So less is more.
Yes.
So that's really nice. So gone the days that we want the overfilled syndrome. Now it's more on your own collagen. You stimulate your own collagen, so you have a more natural, accepting look.
That is why I love regenerative aesthetics. Okay. Crystal Healer,
Crystal Healer.
reversal series. Come on. Now that we are proceeding to the last part of InMore Clinical Conversations, I want to throw some personal questions. The first one is, what keeps you choosing this profession every day? Doc Sophie?
It's definitely the smile on my patient's face when they leave the clinic, and to know why we are doing this, that it's not only about their enhancement of the beauty, but also for their well-being and happiness.
I love that. Well-being and happiness. How about you, Doc Eloisa?
Yes, agree. I can have their confidence and well-being, and it's also this aesthetic medicine is an evolving field, so we don't stop learning and attending symposiums and continuous engaging into these high-yield trainings.
Wonderful. Next is, what's the most fulfilling part of what you do now? Doc Sophie?
I would say the variety that comes with this profession, because it's so dynamic, right? In medicine, we used to study something from the books in university, and then we were supposed to apply the same thing
Yes,
for
same
the
thing.
next 40 years of our life, right?
Yes.
But aesthetics is such a dynamic field, and we can see how everything is evolving towards regenerative medicine, natural enhancements, patients' education. So all of this makes it very spicy.
Yes. How about you, Doc Eloisa?
Yes, transformation is very important. And if my patient is happy, I'm happier.
Yeah.
So that's very important.
Transformative journey with our patients. The next one is, what kind of moments remind you why you started? Who wants to go first? Okay, Doc Eloisa?
Yes, I'm thinking, okay, maybe for me, very rewarding is a simple thank you from my client, my patient. That really is a big thing for me. And also the trust. There are so many doctors like here and with equally good trainings, but then if the patient gives their trust to you, I mean, that's something for me.
Okay, how about you, Doc Sophie?
I started with this field because I've seen that in the public healthcare system, unfortunately, we are not able to take the time for our patient. We are not able to see them in a holistic way and to treat something further than just their symptoms. So working in this field of aesthetic medicine, preventative medicine, integrative medicine, it gives us the opportunity to really take the time for our patients, listen them carefully, and make their life just better and more beautiful.
That is something close to our hearts, the holistic approach and the integrative medicine. Now we're ending the episode of InMore Clinical Conversations. For the last question, if a patient remembers one thing from this conversation, what should it be when it comes to choosing treatments?
I would say don't choose a treatment just because it's popular. Get your information on your doctor, on the product, on what it can help you, because it's your body, what you do this to, what you do this with, and what you do this for.
Yes. Is it actually right for you? How about you, Doc Eloisa?
Yes, actually, the best treatment is not the one that you saw on social media or your neighbor or your favorite artist. It's the one, I think, that respects your natural anatomy. So I think in choosing a doctor, you should prioritize someone that is prioritizing also education. Because after all, I think it's not just a treatment. I think you're investing in your future face.
Okay. You couldn't have said it any better, Doc Eloisa. So that is for InMore Clinical Conversations. This is Doc Phoebus. To learn more about aesthetic training and evidence-based care, follow InMore Medical to stay connected with InMore Clinical Conversations. In our next episode, we'll continue exploring how clinical expertise and patient education shape better outcomes in aesthetic medicine. This has been InMore Clinical Conversations. Thank you for joining us, and remember, the best results come from understanding what you truly need.